Sciatica, that annoying pain that sits in your low back, goes down into your upper leg or even down into your foot, is always there. How do we take care of it, and how do we make you feel better? That's what we're going to discuss today on our first part of a 4-part series on sciatica. Hi, I'm Dr. John Gray, and we're going to discuss first, when we talk about sciatica, the one thing you should remember is we always discuss it in terms of how do you take care of it, and it's always according to the 3 phases of healing. So you look here on the board, we have inflammation. That's the 1 to 3 day cycle once a problem starts to occur. We have repair. Our biggest challenges there are usually getting rid of the nerve entrapment and the nerve sensitivity that you have. That takes anywhere between 6 and 12 weeks, depending on your age and how old you are. And remodeling, which is what we do to make sure it doesn't come back. And we'll talk a little about those as we go. First, I want to just define for you, so you know what you might be struggling with, is the 4 types or 4 main causes of what most people think of as sciatic. There's sometimes real sciatic, and then there's things that are referring to it that feel like sciatic but aren't necessarily. So first we want to define what sciatic is. Sciatic is a term given generally to a group of nerves that come out of the back. These lower 2 out of 4 and 5 in the lower back, and the top 3 here in the sacrum. And as they will meld together, they come out here through a little notch in the pelvis, and there's a muscle that's your external hip rotator that sits over that, and it either comes out above or below that, or some unlucky people have it come right through the middle of that belly, and that can cause them lots of troubles. So today, the main issues that we have with sciatica is, number 1, we can have disc. In other words, this part of the body is wearing down because it's not aligned right, and that area will start to break down, and that creates less space for where one of these nerves come out. So when you have problems with sciatic, it can be just 1 or 2 of the nerves that are actually having the problem. It doesn't have to be all of them, but because they feed into the common nerve, you'll notice it wherever that nerve goes. And then that nerve runs down our leg, and it splits right behind the knee, and some of it comes around the side and front, and then some of it goes down the back, and we'll talk about that, how you can differentiate where the problem's coming from. So one thing can be disc. The other thing people have troubles with is how these guys line up here, the sciatic nerve itself, the SI joints, and they can cause what feels like sciatic. How we differentiate those, that kind of sciatic usually stays above the knee, where the true sciatic, where it's affecting the nerves, will go down into the feet. Okay, so that's number 2. Number 3 is this, where we talked about where that nerve comes out here. It's called the piriformis muscle that overlaps that. That can become tight or inflamed, and that can actually be causing pressure on that nerve as well. So there's ways we can assess for that, and we're going to give you a little tip on how to help yourself correct that at the end of the video here. Okay, so we covered the 3, and then the next one would be irritation on these back parts of these joints. You notice how if we open these up, you see these back parts of these joints here, they call them facets. So they usually, when they get hurt, a lot of times they will be coinciding with disc issues, because they're sitting too deep. That's one of the number 1 causes. Or they can be riding up high, and there's 2 different ways to help correct that. But that can cause irritation that flows down into here and flows down into the small of the back, into the bum. And people will think that is sciatic as well. And we'll show you. On our 4-part series, we're going to cover all of these and give you different ways to help cope with them. But first, for today's tip, we're just going to talk about piriformis. So there's a couple of ways you can stretch that. And the bottom line of it is you want your knee and your ankle coming towards your opposite shoulder. And then there's a couple other stretches we can do here. If you'll see Patrick here on this video, he'll be doing a figure 4. And then right after that, we can do an adaptation. You'll see him doing one where we do it, you bring the knee up and over, and you do it on a table or on a bed. And that's a nice way to do it, especially if you have a hard time getting up and down. You can just do that on your bed or on some kind of couch or something where you don't have to get down very low. And that'll help stretch that muscle so it's not irritating you. And the other tip is make sure that you don't cross your ankles or your knees. for the SI part of it, because when you do that, that flares this area, okay? And also laying on your side can flare that area. I know there's lots of ways, things we can go into. That's kind of getting into the next one. If you're not sure which one you have, we make it easy for people to come in and get assessed and see where the problem's coming from, so you can have a little more direction on which way you go. But for the meantime, it never hurts to stretch that piriformis and follow those exercises we just showed you. Have a great day, and we'll see you next week with our next tip on how to help with sciatic pain.